Go.
Thank you, Mr Deputy Speaker, and it's an honour to follow the member for Glasgow South West, who made a passionate speech, especially in respect of the women who were denied their pension rights born in the 1950s. Mr Deputy Speaker, I was disappointed to see only one reference to mental health in the Queen's speech, and even then it was only referring to the Mental Health Act. And I was disappointed to see in the attached background briefing that the government's much vaunted parity of esteem does not stretch to any new funding for mental health services. 1 in 10 children and young people in the UK suffer at some point with mental ill health, and in Birmingham nearly 40% of the population are under 25. Mr Deputy Speaker, I'm sure you will be horrified to learn that despite that, for the whole of Birmingham, there is only one early intervention counselling service for young people. Shocking. The most recent count of the counselling service waiting list saw 400 young people waiting for a service. That's 400 young people in desperate need of support who require treatment urgently. That's 400 young people who will have to wait months to see someone. And that's 400 young people and families who in most cases have nowhere else to turn. And this unwillingness to recognise or properly fund vital prevention is yet another example of the Conservative government failing our children and our young people. Mr Deputy Speaker, is the Secretary of State surprised that more and more young people are ending up in A&E when we neglect early intervention care? We need to listen to the growing needs that young people have from young people themselves. The government are not doing this, and that is why I have launched a Young People's Mental Health Working Group, supported by Open Door Counselling, which is a local charity in my constituency, and the Centre for Mental Health. And this group will use their unique perspective to help shape the services they use for the better. Young people have a voice that we need to listen to. So what steps is the government taking to ensure that it works closely with young people with lived experience of mental health when developing future legislative and non-legislative actions related to mental health? Cuts have consequences. Slashing budgets removes safety nets for the most vulnerable in our society and has knock-on effects. I'm sure the Secretary of State knows that excluded students are 10 times more likely to suffer from mental health problems. So what steps is he taking alongside his colleague in the Department for Education to support those students rather than just hanging them out to dry? An inquiry by Birmingham and Solihull Mental Health Trust into 11 deaths found that they were probably avoidable. This is unacceptable, and it is vital that lessons are learnt. With one of the highest levels of occupied beds by patients with complex needs and one of the lowest number of beds per 100,000 coupled with cuts and underinvestment under the Conservatives, what steps is the Secretary of State taking so my constituents will be properly looked after and that no more families will be forced to go through the pain and heartbreak of being told that a loved one's death was probably avoidable? I would like to briefly touch on the Secretary of State's favourite private healthcare company, or at least the one he talks about the most and publicly endorses, while simultaneously insisting that there will be no more privatisation of the NHS under him. I should also note that the Secretary of State is not alone in his support for Babylon, and as I am sure this House is well aware, the most senior member of the Prime Minister's team advised Babylon as recently as last year. Mr Deputy Speaker, the reason hospitals like the Queen Elizabeth Hospital in my constituency are being forced to take risks in using totally unproven private technical solutions is because they are not receiving sufficient support from this government. The Tories over the past 9 years have stripped the NHS and made it about profit rather than patients. My constituents are rightly worried about the continued growth of companies like Babylon Healthcare as their tentacles in Birmingham reach out beyond GP at hand. And the Secretary of State holds them up as a beacon of light in replacing face-to-face services. But with 94% of enrolled patients under the age of 45, 2/3 of them living in more affluent areas, can he tell me how it will work for my more vulnerable constituents? And can he give answers to the myriad of the other justified concerns from GPs, CCGs and professional bodies? I want to end by paying tribute to the magnificent practitioners and staff who work day in, day out across the various health services that we have. I want to thank those who come from around the world to support us when we need it, whether that is due to mental health problems, physical ailments, old age or any other issue. They deserve to be supported. They deserve to be properly resourced. They deserve to be treated with respect, and they deserve a government that gives them more than empty rhetoric. And I'm sorry that over the last 9 years, under the Coalition and then the Conservative government, they have not been treated in the way that they deserve. Thank you.